Nothing goes as planned. Plan on that. All right, this is part 2 of my surgery story. My name is Renee. I'm 39 years old and I'm a breast cancer survivor. And in my last video, I shared part 1 of my surgery. So everything that happened in the hospital until coming home. And now this is part 2. But the theme of this is nothing goes as planned. Plan on that. So I'm home, I'm recovering, feeling all the things, trying to, gain my strength back and, really just move forward, and hoping that I only had one more surgery ahead of me, which would be the exchange from expander to implant. I, met with my oncologist, got that final pathology report, and everything seemed to be like great news that cancer hadn't spread. No chemo, no radiation. They got clean margins when they did the mastectomy. So it was all wonderful news. So my job was just to heal and move on and get ready for that exchange to close that chapter. So, I had a lot of reactions from the surgery, not just the blood issues that I had, but I had a lot of skin issues. So I wouldn't consider myself having sensitive skin. I mean, I have some sensitive skin, especially like on my face, but I don't consider that on my body. But I really reacted to the surgical tape. And of course, there was tape over my incisions under each, breast. There's a huge incision under each one. I had tape on my drains, taping that first part of the drain to my body. There were covers covering where the drain holes were, so where the drains were placed. I had, just these blisters from the tape. So huge blisters, and my skin was a mess from like here down. I had your typical bruising and swelling on the chest, but it was very interesting to see how the rest of my skin from the tape was reacting. But I didn't have to clean my incisions or anything like that. Depending on what type of stitches you have, you might be instructed to do that. I was fine. I was cleared after a couple of days to take a shower if I, felt ready. But I didn't have to do any type of, cleaning of the incisions. The only job I had was heal and then, milk the drains, make sure that fluid, that blood and other fluid was moving properly through the drains. So every week I would go into my plastic surgeon's office, and he would, just check on me, look at everything. And then we started slowly doing the fills and the expanders. My breast surgeon had basically released me and said, my job is done. Now you're on to your plastic surgeon. So every week I was being seen, which was great to have, medical eyes on me throughout that healing process. But there was, along with all of the swelling and the skin reactions there were bruising. There was a lot of bruising as well. I had this section just under my nipple and above the incision on the right side that looked almost like a really big blood blister. I won't get too graphic, but it was about the size of a dollar coin. And it was red and purpley, and I just assumed that it was either a blood blister or just a collection of blood that was kind of sitting there. And of course, this was the cancer side. So my surgeon was a little more aggressive on that side because he was saving my life, and he was getting as close to the skin surface as possible to remove as much tissue as he could, which left my skin super thin and frail. So especially on this side, there just wasn't a whole lot. Like if there was any skin, dying off, there was nothing to replenish it underneath. And that's what happened. I had a huge chunk of skin that was basically, it's called skin necrosis. and that's when the skin dies. I was kind of waiting and hoping it would heal on its own, and my surgeon was also hoping. He said, this could kind of go either way. We're just going to keep watching it and watching it. And it was about 3 weeks after my initial surgery that he said, we've got to remove this. We have to cut this part out. So I had kind of already gotten to a point in my expanders where I felt comfortable. And I said, well, if you're already putting me under, can we just do the exchange now? Get out these uncomfortable expanders, get the implants in, bye, be done. He's like, yeah, you're at a point we could do that. I said, okay, great. I'm going to kill 2 birds with 1 stone. Awesome. So I thought. So we go in for a surgery, which is nothing compared to the mastectomy. But, it's you go in and then you come home that day as if all goes planned. And so he removed the skin. So then that gave another incision, like an anchor basically. So from here down, and then I've got the big one underneath too. And then the implants were placed. So the expanders were out, and oh my gosh, the relief when those expanders come out, it is just, you can actually breathe. It's amazing. So I was feeling great. The left side was feeling great. Everything was doing fine. Once the tape off of that new incision started to come off, I noticed it again, the skin just didn't look so great around that incision. And so I went in for, again, being seen weekly. So about a week after that second surgery, I went in and the tape had just fallen off of the incision. And he said, this could go either way, but the skin doesn't look so strong there. And I'm afraid that the incision is going to open. And if it opens, your implant will be exposed. You will get an infection. That's an emergency situation. He said, we're going to watch it. So I want you to come back in a couple days. Okay. So I'm watching it and praying and hoping and keeping it clean. And I go in a couple days, and I knew, I kind of stopped looking at it because I didn't want to know, but I knew the incision had opened, the implant was exposed, and he needed to do surgery immediately. What that meant, not only did that mean to fix the incision, but it meant the implant needed to be removed. My body was so traumatized on this right side, and I can't blame my surgeon for that. He was saving my life, getting rid of the cancer and getting rid of as much tissue as possible. But he had to be as close to the skin surface to get all that tissue out that my skin just was traumatized. So a day later, I went in for my 3rd surgery to open up that new incision, remove the implant, take off some of that skin around that incision, stitch it back up again, and sit flat and wait and rest and heal. So, it's really hard when, you're trying to be in control. You're trying to take things into your own hands, things that are out of, your hands you would go along with, but the things you can take control over, you try to so hard, and you're so desperate for those things to work. And when they don't, it's like so heartbreaking. It's okay. A lot of people choose to go flat after a mastectomy and not have any reconstruction. But the tricky part is I'm reconstructed just fine on one side. And I want to be reconstructed. I deserve that. So my surgeon told me that after I waited about a month or so that he would clear me to attempt reconstruction again. And I said, no, I need the time. And I said, is there anything wrong with just sitting for as long as I want? Like, is that gonna create problems down the road? And he said, no, if anything, it's gonna help. But I know mentally, this is extremely difficult for you. And I said, I know, but I don't want to go through this again. And I know that it's not guaranteed. I could attempt again and it could fail. We don't know how much skin we have left to even work with at this point. But I'm giving myself the time to heal mentally and physically, to pause and give my body a break, because I just feel like my body was giving me signs to say, stop, stop it. So I'm listening to my body and I'm doing that, which is also why I'm not moving on to the next phase of treatment, which is endocrine therapy, because I am giving my body a break. So when I'm ready, I will have a surgery that will again go back to expander, to slowly expand and see what we have to work with, what's going on. I might have to do another type of surgery for reconstruction after that. We don't know. But the expander will tell us a lot, whether I can eventually have an implant or not, or take my lat muscle and use that as well to build. There are some options, but I'll know when I'm ready. Right now, I'm just enjoying kind of pretending that nothing happened. I just think in this situation, you really have to trust your gut. I got second opinions as well during this time, and it's just given me a lot of confidence to make these decisions. So that's what's happened. Nothing went as planned, but you bend and you flex and you go with it. You go with it and you figure it out. And that's my story.